This is the story of how my people survived their country from COVID-19 coronavirus. The tiny virus, too small to see it, very hard to diagnose the infected person during the incubation period, which is almost 14 days. The story shows the will of my people to fight together with the hidden small enemy and stop the spread of it. At first, many people around the world were saying it is a normal flu and did not listen to the healthcare instructions such as stay home, wash your hand frequently, and avoid handshake and necking each other. Until the disease spread all over the world and became a global epidemic. But my people were different and followed the local health workers' instructions, and from time to time were visiting World Health Organization website to receive accurate information on how to limit the spread and protect themselves from coronavirus. My friend's grandfather went to the market to buy some food. There he met his friend who was in an incubation period of coronavirus. Without realizing, the grandfather touched his nose. Coronavirus came into his lung. Days went by, then grandfather got a terrible fever, cough, dyspnea, and weakness. At first, we thought it is a normal flu, but he was soon much worse, had even vomiting, hard breath, and his fever got even higher. I decided to call the emergency center. Unfortunately, the grandfather had died in hospital. I was heartbroken for losing my friend's grandfather. After which, the health expert team came and explained to us when a person has symptoms of normal flu such as fever, cough, hard breathing, and so on, do not touch them and directly call the emergency center. The virus can transfer from one person to another, even during incubation period. Days passed, and we heard the number of infected people by the new disease are increased dramatically. Good news is the healing rate was much higher than deaths rate. At least we understood the new disease. It could spread further and kill many more people if we do not follow the instructions carefully. World Health Organization explained that coronavirus even can stay in dead bodies. For others' protection, my friend decided not to make a consolation of his grandfather and did a voluntary quarantine at home. When somebody died of coronavirus, that body is much more contagious. No one should ever touch the dead body. The buried team came, comforted us, and explained what they should do to protect us. Trained buried team buried my friend's grandfather safely. The team were wearing protective clothes that kept them safe from the dangerous virus. Then, they started to sterilize the house and burned all grandfather's belongings, mattress, clothes, blankets, to prevent the spread of the disease. That is right. At first, it was very difficult to accept such burying methods and not to follow our traditions and classical methods of consolation. But in the end, we had to make a rational decision and realize those actions make ours and others' life safer. The Ministry of Health announced some instruction of what to do, and what not to do. All citizens were agreed and followed the instruction carefully. This was the starting point to overcome the tiny enemy, coronavirus. Here are the instructions what to do. 1. Stay home. 2. Wash your hand with soap frequently. 3. Sterilization of your house from time to time. What not to do. 1. Avoid handshake with anyone. 2. Avoid hug with anyone. 3. Do not touch your nose, eyes, and mouth before washing your hand. We became stronger day after day to realize it is natural to feel coronavirus, but if we trust our healthcare workers and follow their regulations, we can survive and stop the disease. Since I had close contact with my friend and his grandfather, I was at risk of getting coronavirus. Almost all people in my region decided to make a voluntary quarantine at home for 14 days, to separate infected people from non-infected one. Every early morning, we were holding our breath for 10 seconds to check if our breath is still normal or not. Unfortunately, after 13 days my friend called and said he has a fever and difficulty to breathe, almost the same signs of his grandfather had. I felt very sad, and I called emergency department and explained my friend's situation. I knew that I could not touch him or help him to take to the nearest healthcare or hospital. At treatment center I heard very bad news that my friend tested positive of COVID-19. He was in isolated room and department of the treatment center. No one could meet him except specialized health workers. Health workers were very helpful and took good care of my infected friend. Health workers told my friend the best medicine for this new disease are psychological resistance, good food, and people immunity. I miss my friend from time to time. I was talking to him by phone and encouraging him to overcome the disease. Sadly, some people from my country did not survive from coronavirus, but my friend got better day after day. One day my friend called me and said he would live and recovered completely from coronavirus. Now we are happy that we stopped the spread of coronavirus, and we all cooperated together to survive. By following the health workers and World Health Organization instruction, you also can clean your country from coronavirus by following the instruction carefully. Again, the instruction are, what to do. 1. Stay home and wash your hand with soap frequently. 2. Sterilization of your house from time to time. 3. Pray for safety. What not to do. 1. Avoid handshake with anyone. 2. Avoid hug with anyone. 3. Do not touch your nose, eyes, and mouth before washing your hand. God save and bless you all. With health and safety to all the good ones. Greetings. Directed by Sado Haji Hamo.